Hi, I am Kokisha Jackson, a student here at Valdosta State University, and I will be discussing lupus in Eastern Europe. What is lupus? Lupus is an autoimmune disease where the body's immune system becomes hyperactive and attacks normal, healthy tissue that leads to symptoms such as inflammation, swelling, damage to joints, skin, kidneys, blood, the heart, and the lungs. As you can see here on the right, these are a pair of hands that have been damaged due to lupus. On the left here is an artist by the name of Seal who has damage to his skin on his face. The first drug that I will be discussing is hydroxychloroquine. Its mechanism of action is that it treats symptoms of lupus. It increases lysosomal pH in antigen presenting cells, and the HCQ decreases toll-like receptor signaling, reduces the activation of dendritic cells and the inflammatory process. Side effects include acne, anemia, blisters to the mouth and eyes, blood disorders, hives, itchiness, and weakness. Dosage is taken orally and about 200 milligrams or 400 milligrams per day. The second drug that I will be discussing is acetaminophen. Its mechanism of action is that it suppresses pain through the central nervous system and it deadens neural response that causes pain. So, in other words, it's a pain reliever. As you can see here below, the picture of the Tylenol is just basically saying that acetaminophen is Tylenol. Its side effects can be that they can cause liver damage, and for chronic users, it may heighten the risk of developing blood cancer. The third and final drug that I will be discussing is indomethacin. Its mechanism of action basically is the inhibition of GH synthase. GH synthase is involved in fever, pain, swelling, inflammation, and platelet aggregation, all of which are symptoms of lupus. So, indomethacin is a treatment for lupus symptoms. Side effects include vomiting, diarrhea, constipation, erectile irritation, headaches, and ringing in the ears. There are three types of delivery mechanisms, which include oral. Its dosage are between 25, 50, or 75 milligrams. Injection, which is 1 milligram. Suppository can either be 100 milligrams or 50 milligrams. Topic of discussion is lupus in Eastern Europe. So let's discuss the background of this region. Eastern Europe is a region that consists of about 20 countries. It is a temperate climate, and its average life expectancy of the entire region is about 74.46 years for male and female together. Just an overview of what their government is like. Nine countries are parliamentary democracy, two are democratic republic, five are republic, one is constitutional republic, one is democracy, one is an emerging democracy, and another is parliamentary democratic republic. So basically, most of them are democratic governments. But what are the vectors in Eastern Europe that contributes to lupus? For one, gender. Mostly women are affected. And as you can see here on the left, there's a picture of a woman from Romania, which is a country in Eastern Europe. Genetics can be a cause. So if there's members in your family who are affected or fall ill to lupus, you are more likely to become ill to lupus as well. Statistically speaking, one in every 750 women will be affected with lupus in Eastern Europe, and a ratio of women to men is about 9 to 1. men affected with lupus. Some other triggers of lupus in Eastern Europe involve puberty, after childbirth, result of trauma, medication induced through sunlight during menopause. Although these are some triggers that have been studied, there is still no definite cause defined yet. And again, there is no cure. Scientists are still studying this disease, and hopefully, we will have a cure for this disease in the next 10 years. Who knows? And thanks for watching.